Hello viewers, you are welcome to another episode of Healthy Lifestyle Choices. This is that particular channel that discusses everything about our health and our well-being. Right here we try to motivate styles of living that support our health and our well-being and discourages unhealthy lifestyles. So if you are coming in here for the very first time, you are highly welcome. I'm still your friend Chidema Ukafo. I will always encourage you to try as much as possible to watch our videos to the end and also watch our old videos as well because they're highly educative. Okay, to our returning subscribers, thank you for stopping by again. Thank you for all you do to see that this channel still exists. We appreciate all your effort. Okay, without wasting much of our time today, we want to talk about a very crucial topic: iron deficiency anemia. Iron deficiency anemia is one of the commonest type of anemia that affects mostly women of childbearing age, as in women of reproductive age. Okay, is one of the leading cause of mortality rate among this age group, either directly or indirectly. Okay, in the course of today's discussion, we'll be having a very special guest, a professional nurse, a very articulated nurse, intelligentness, very beautiful nurse, experienced nurse. Her name is Judy Ann. She's a nurse, professional nurse from Jamaica. She has had about 15 years experience in nursing. At the moment, she is in UK practicing as a registered nurse. She's very experienced. She's educated. She's grounded. She had a lot of information about iron deficiency anemia. Okay, so she's gonna anchor this discussion to the very end. Please stay tuned, watch the show, share with your friends, invite mothers, invite teachers, invite your aunties, invite your niece. We have got a lot of information here that will help you to prevent iron deficiency, especially among our girl child, especially among our mothers. Right? So stay tuned. If you have any questions, please pen down your question in the comment section. I will see you later on next week. Please stay tuned. Bye for now. Bye.
My name is Jody Ann Curlew. I am a trained registered nurse, trained at Northern Caribbean University in Jamaica, and I'm here working in the United Kingdom as a qualified nurse. So I've been asked to actually speak to you guys on the importance of iron in your blood, some ways that we know that we are low in iron, some natural ways that we can actually keep our iron levels up, and what the real importance of iron and maintaining a good level, and some other stuff. All right. So basically, what is iron? Iron basically is a mineral that is required to help with the production of red blood cells. And red blood cells are very important because they are part of the composition, they're part of the blood. And what they do is they carry around oxygen around your body. And if we don't have enough red blood cells to carry around oxygen in your body, then automatically we will have some really unpleasant symptoms that are associated with that. Okay, so how do we know that we are low in iron? We know that we are low in iron because when we experience some symptoms like frequent headaches, pale skin, and when I say pale skin, like somebody will almost look white. You look at the person and they don't have the same plump, rosy look in their skin and everything. Sometimes when you go to the doctor, because you're trying to stay awake all the time, and you're always sleeping. You feel like you want to sleep all the time. Yeah. Sometimes what the doctor will do, doctor will just pull down your eyelids like this and look into your eyelids. Right now, I'm actually low in iron and I'm on supplement, but we'll get to that. So they'll just pull your eyelids down and they'll look at that to see how pink and how rich that color is. Normally, if you're low in iron, it looks very pale. Very pale, right? And the palm of your hands will look very pale and white. So you just don't feel like your right self. Some persons experience heart palpitations. When I say heart palpitations, I mean like you feel like your heart is beating really fast, racing. That's because your heart is trying to, in the medical term we say compensate. So it's trying to help the body to get around more blood, because I won't go into all the technical details, but this is some a way that your body responds when you have low iron levels. You get heart palpitation, meaning your heart racing and everything. Pale skin, you're feeling tired all the time, frequent headaches. Some persons have a very low and heavy feeling above the eyes, over above the eyebrows, most of the times. Yeah, that's how we know. And also when you go to the doctor will maybe most likely prescribe some blood tests for you to do to check your iron levels. He'll check your hemoglobin levels and your cell levels, so a complete blood count you will actually check. All right, and those results will tell the doctor how much length of time of iron or what medical interventions are supposed to be taken. But before we go to the medical interventions, some things that we can do to actually help with maintaining our iron levels at a good level are: we can consume molasses. That is my absolute favorite. Molasses molasses You get molasses is obtained, it's actually a byproduct of sugar production, right? I know from sugar production you get bagasse and you get molasses. Molasses is rich, very rich in iron, very very rich in iron. It's a natural form, right? So you can have it like a milkshake, you can have it cold, you can have it has a natural sweetness of it. And also what I use it to do as well, I use it to use as a natural browning to give my chicken color when I do brown stew chicken or fried chicken. Another thing that you can actually consume is beetroot or beets. Okay, another one that you can actually consume is curly kale. Another one, I know that's from my country, that's callaloo. Some other ones are leafy, dark green and leafy salads, like rockets and baby leaf and spinach. Millets can also be used as well to actually do that. String beans, green beans, okra, also one of my favorites, sweet potatoes, prunes, raisins, right? Anything dark green, leafy vegetables, anything like those, you take those, and they do help to maintain a very good iron level. Now, it is important to note that when you're taking iron-rich food, you also need to take not iron-rich, vitamin C rich foods, because the vitamin C helps with the absorption of iron. Very, very important. Very, very important. Also, if it is a case where natural remedies are not helping with maintaining your iron levels and it may need other medical interventions, then your doctor may prescribe some oral tablets, iron supplements for you to have. Now, some persons may have some very unpleasant symptoms with these, but what you can do is take those tablets with vitamin C rich juices. Drink them with juices. Some persons, and you take them according to how your doctor has instructed you. But if you're having major problems with them, you do speak with your doctor as well. Some persons may have dark stool. That is very very okay when you're taking iron supplement. It does make your stool dark, so you're not dying, trust me. So it does make your stool dark. Some persons experience constipation. I can't take those tablets because I do get those symptoms as well, so I have to use the natural remedies. And even if I take those tablets, I have to take them maybe every 2 days or so, along with natural stuff to help with my maintaining my iron levels. But yeah, you can actually use those to maintain a good iron level. But what causes low iron levels though? You know, what cause these things to happen? Females of childbearing age, that age group between say 18 to 30 something, 38. We are most at risk. We have the bit most trouble with iron level problems, because guess what? Pregnancy is another reason why our iron levels will go low, very low, because it's needed with the natural formation of the baby and helping with the natural development of the unborn fetus, the unborn baby. Yes. So pregnancy is a big thing. Some medications are very harsh on your stomach, and what they will do is to eat away the lining of your stomach walls and cause you to have some level of bleed in your stomach lining. Now, that's a nasty something to happen, because your stomach has a very rich blood supply. Very, very rich blood supply. And we do not want anything eating away at our stomach lining. So medications, for example, medication like ibuprofen, or they call it brufen, that medication is quite harsh on your stomach, and it's advisable that you do not take that medication on an empty stomach. If you are high risk of having gastritis, that's inflammation of the stomach wall, or something like if you have had history of stomach ulcers, then your doctor might also prescribe something to coat the lining of your stomach while you're on these medications, or he won't prescribe them at all. You find an alternative. Another medication that can cause you to have problems with your tummy is aspirin. Those are very harsh on your tummy as well. Another reason why you would have like problems with iron levels is if you have cancer of your colon. Some persons say cancer of the bowels. So your colon is the largest part of your intestines, and persons normally have problems there. If you are having cancer of the bowels or the colon, then you will have problems. So the colon, that large, I'm not sure if you've ever seen a diagram of the colon. So it's like one part go up, across, then right over here. So that part is the part that will most likely have the cancerous areas there. And if it is a case where you're having issues there, you'll actually have blood in your feces. The doctor will prescribe a stool sample, to take a stool sample, like sample up your feces, send it out to the lab to identify if there's any presence of blood in your sample. And if there's a presence of blood in your sample, high chance they would have to do some more investigations to find out why is there presence of blood in your stool, in your feces. And most likely some persons will have cancer. That's why it's causing that situation. So most times, treating a low iron level is geared at basically attacking the cause of the low iron level. If your low iron level is there because you're not eating iron rich foods and vitamin C rich foods, then we tackle the diet. If the problem is you have an issue with your colon or your bowels, then we tackle that. If the problem is pregnancy, then you know that you have to keep up with your folic acid and your iron tablets during pregnancy, your prenatal vitamins during pregnancy. It's a situation that we just have to do with women of childbearing age. We just have to keep up with that situation, or we could end up in problems. And those things. Yes. So yes, so as we see, it is very simple and very easy to maintain our iron levels outside of other medical issues as to why, like cancer or any form of inflammation of the stomach or whatever. It is very simple. It's a very simple way of maintaining our iron levels, and it's just that we just have to keep on going with it. It's not like we can do it this month and next month to just say, you know what, I'm not going to do it anymore, and the next month, I'm not going to do it. You have to continue doing it because our bodies don't store it. Vitamin C is not stored in our bodies at all. You have to get it daily. And iron, we don't store much of it, so you have to put it in to ensure that it works, right? All of that. One thing I need to mention also, persons who are low in iron, they tend to want to eat some weird things. Have you ever heard persons saying that they like the taste of marl or chalk? You know, the chalk that you used to write on the chalkboards back in the day? Persons eating those or eating stones. Yeah, that is a symptom of low iron levels. They call it pica. Some persons call it pica. Some persons say pica. Yes, it's a symptom of very, very low iron levels. So yeah, that's the situation. So how much do we need? I think I have some information here. So children of women, children, oh my days. Women of childbearing age, so up to from between the ages of 19 to 50, we are supposed to be having 14.8 milligrams of iron per day. 14.8 milligrams of iron per day, right? Men over the age of 18 require only 8.7 milligrams, and females over 50 only 8.7 milligrams. So you see, children of childbearing, why do I keep saying children of childbearing age? Women of childbearing age require the most, because that is the important age group and gender at the moment. Women of childbearing age need a lot of it, a lot more. So we need to be taking care of ourselves as women and maintaining those iron levels as much as possible. Okay, so let's try to do a recap. So low iron, what is iron? Iron, the mineral that is used in the production of red blood cells. It is then the red blood cells are needed for carrying oxygen around the blood. If you don't have enough of the iron levels in your body, then we become tired, we have itchy skin, we have pale skin, we have heart palpitation, or your heart feels like it's racing, shortness of breath, and all of that. Some natural ways that we can actually maintain our iron levels is by eating beetroot or beets, dark green leafy vegetables like broccoli, curly kale, leafy salad, spinach, sweet potatoes, okra, millets, beets, and the whole works. Some causes of low iron levels are like cancer of the bowels or cancer of the colon, heavy periods. Oh, I forgot to mention heavy menstrual cycle. Oh, heavy menstrual cycle. That is one of the main problems, because females of childbearing age, we have our menses, yes, our periods, and some women have it very, 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 very heavy, very, 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 very heavy, and that can cause iron deficiency anemia. That's the name of it when you have low iron deficiency anemia, right? So that's one of the situations. So we need to do all of that, right? Some persons will need medical interventions, but there are simple ways of getting your iron level up. My favorite is molasses. I haven't been able to find any molasses since I got here in this country. I'm not sure if I'm not looking in the right areas, but if you know, just you can comment below. so that these ladies, these lovely ladies of this channel, can actually find it too, and other persons viewing this content can actually find it too as well. Thank you for having me. I hope that I've covered all the bits and bobs of it. My source was the NHS website. Just type in low iron levels and you get all the information as well if you want to reread or if you want to watch this video again. Thank you very much for having me. Toodaloo! Okay, so what I've done is I have minced up some green apples and put them in a little bit of water, and now I am gonna blend. Ding! So because I don't have a fancy blender, I'm just gonna strain this off and retain the water to blend the rest. All right, so now I'm just gonna cut up the beets. So you know the apples are a good source of, excellent source of vitamin C. So I'm just gonna chop a few of these beets that are on display and just yank them in there. Just yanking there. These were already cooked, but you can use the raw ones. But these are already cooked. Rich in iron. These are beetroots, rich in iron. So we see, we use one for now and see what that is. And you blend again. And once again, I don't have a fancy juicer, so I shall be straining this baby off. Now I've strained this off. I'm just gonna pour it in a glass. Alright, so 1 apple, 1 beet with a little bit of water makes about 1 glass of that juice. Some persons can choose to drink it as it is. Just the beets, beetroot, and 1 green apple. They can choose to add a bit of lemon juice to it. Squeeze it in there. Half a lemon. Some persons like it really tangy, yeah, because the beetroot sometimes it has a natural sweetness to it. Sometimes I find it that way. Some persons will choose to include honey and so forth. Yeah, some persons choose to put a little bit of honey in it. Put like 1 teaspoon of honey. You can also choose to allow, if some persons like a little bit of the, I shouldn't say pulp, it's like the stuff that you strain out. Some persons like a little bit in it just to give it a little bit of fiber boost. Some persons like it without it. So yeah, just mix it around with a nice swirl. Let's see what it tastes like. Yeah, man. Yes. That's it. So this is a simple way of getting iron in. Simple. Remember, iron, vitamin C. Yes, they go together. Thank you for having me. Bye-bye.